I'm Andy Obermiller, editor of Government Driven Investing. I specialize in showing individual investors like you how to profit from major actions like the bailout of the financial system and the economic stimulus package. In fact, I noticed the watchdog agency that's been overseeing the bailout said the cost would amount to $23.7 trillion. That's a cost of $80,000 for each American. Now you can do one of three things with that number. You can have a heart attack. I know that's how I felt when I first heard the cost, which of course came in higher than was forecast and is expected to continue to grow. The second thing you could do is to ignore these big numbers, but the third option, and this is my favorite, is to leverage the government's actions to make you money. I want you to keep something in mind. Every time one of those 23.7 trillion public dollars is spent, a private sector profit will be realized. If Washington's going to spend all this money anyway, smart investors might as well figure out how to profit from it. But government action goes beyond the stimulus and the bailout. Uncle Sam's reach is immense. He's the biggest financial force on earth. Now, you've been hearing a lot about healthcare, and I bet you've heard the phrase single payer. That's the idea that one entity, in this case the federal government, should be responsible for paying for the nation's healthcare costs. That's a matter of great debate, and the worry among those who oppose it is that no one could make any money under a single-payer system like that. Not doctors, not hospitals, not pharmaceutical companies, no one. I'm not going to address the politics of healthcare, but I can tell you that it's not true that no one can make money under a single-payer system. As it happens, even without the change that Mr. Obama has promised to deliver, there are already several areas in healthcare for which the government is already the single payer. One such area is dialysis. And each patient who needs this life-saving kidney treatment is enrolled in Medicare regardless of age. Medicare pays for all the kidney treatments in the United States. This is one of the blessings of living in a wealthy country, and I think it's something to be thankful for. But we should, in our gratitude, remember that there's a difference between price and cost. Medicare isn't reimbursing dialysis providers solely for their costs. It pays them a certain price per patient treatment. And remember these two eights. Dialysis providers took in more than $8 billion last year, and they earned a net profit of about 8%. And going forward, those smart companies will find ways to cut costs, increase revenue, expand their business, and generate more and still more profits for their shareholders. The government is perfectly okay with that setup. It's not in the medical business, it just writes checks. And Uncle Sam knows that he must incentivize the delivery of this critical treatment with profit. If you want dialysis or treatment for a chronic condition or disease of any kind, the solution is simple. You have to pay for it. Now, some say profits are killing healthcare, but I think the profit motive is why the U.S. is the birthplace of every major medical advance. Dialysis has been around for a while, and it's not particularly expensive. And since it's already distributed under a single payer system, it's one area of the market that's not going to change under an expansion of the nation's healthcare system. That gives dialysis legislative shelter that other healthcare companies don't have. The dialysis business model is safe, and Wall Street likes that. The nation's dialysis providers, which I reveal my research on in the August issue of Government Driven Investing, are also immune from economic downturn. And one of my favorite companies in this area has increased earnings every year since 2005, including last year, and it's on track to grow nearly 8% this year. Dialysis providers have a steady supply of patients, and their only customer, Medicare, always pays the bill. As in any field, the best operators grow into the most valuable companies. That's one of the reasons the industry leader has outperformed the S&P 500 by 71.1 percentage points for the past 5 years. I look forward to detailing this research in my August issue of Government Driven Investing. I'm Andy Obermiller. Thanks for watching.